Hemophilia B is the deficiency of the factor 9. Likewise, in the hemophilia A, as you have seen that how factor 8 is important in the activation of the fibrinogen to the fibrin. Now here we will see that how factor 9 is important in the activation of the coagulation cascade and the formation of the blood clot. Now the same diagram that you have seen in the hemophilia A, here you can see that now when the patient is suffering from the hemophilia B, then this factor is important, factor 9. Now factor 9 is important again with the factor 8 because factor 9 is going to activate the factor 8. Along with the factor 8A, it will be converted into a complex that is very important in the activation of the factor 10. Now, you can see that factor 9 is activated into the factor 9A. 9A along with the 8A will form a complex. This complex will activate factor 10 to 10A, and then again a complex will form that will activate the factor 2, that is the prothrombin to the thrombin, and ultimately the fibrinogen will be activated to the fibrin. That will be responsible for the cross-linking fibrin, that will be activated for the aggregation of the platelets and their further activation. Ultimately, a blood clot will be formed. Now, when this thing is not present here, there is the deficiency of the factor 9. All of these steps will be compromised, and the process of the blood clot formation will, you can say, will be hindered, and there will be no aggregation of the platelet, no blood clot formation. As a result, what will happen that the patient will suffer from hemorrhage and constant bleeding, and it will be very difficult in such kind of the patient to stop the bleeding.